Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. Well, today I'm going to talk about what I have done, or the stuff that I did throughout the day today. Well, basically, as most of you might have already known, especially those who follow my Facebook. Not to say that I'm famous, but you know, um, I am currently doing my critical care rotation, and last week I did anesthesia, perioperative. So this week I'm doing acute care. So for during the acute care rotation, I'll be hanging around ICU and also HDU, obstetrics ward, and also the other one is pain rounds and clinics, if there's any. So today, basically, I learned a lot. Fortunately, I was I were the three of us, myself, Sushan, and Katrina Kovican. We were attached to a very helpful consultant. She really she is really into teaching students. She doesn't leave us just hanging around there, knowing what to do and stuff. So she actually taught us a lot. Today I was attached to a patient who a 54-year-old female, um, intubated and ventilated, day 4 in ICU due to traumatic injury to the brain. Secondary, due to a fall following a traumatic, following a fall on a staircase secondary to alcohol. So this lady, emergency CT scan showed that she has a fracture in the um, left porous temporal bone, hemorrhagic contusions to the right temporal lobe and inferior frontal lobe, and also non-hemorrhagic contusions in the left side. So her GHCS upon arrival of the paramedics at her home was 4, and her GHCS on arrival to A&E was 9. So uh, yeah, and her past medical history and surgical history was unremarkable. She's not on any medications before the incident happened. There's no significant family history, and she is a heavy smoker. She smokes 20 to 30 cigarettes per day, and she is an occasional binge drinker. I mean, alcohol. So, well, what else should I say about this patient? Neuro. Okay, this morning, we stopped her sedation. She was sedated with propofol and morphine. We stopped her sedation to wake her up to assess her and to assess the patient neurologically. She woke up around half an hour to 45 minutes upon discontinuation of sedation. There were movement of upper and lower limbs, but they weren't uh, purposeful. It means that she wasn't obeying instructions. She was just moving around, and the movement of the left upper and lower limb was more than left upper and lower limb. There was significant difference in terms of activity of both sides. So a repeat CT was done later today, and there were no difference. There were no changes, significant changes. And what else should I say about neuro? Her GCS is 9, no 7, 7. When she woke up, as I mentioned, there were movement of limbs, but there were no eye opening. She wasn't saying anything. I think that's all. Yeah. Respiratory, she's on 30% of oxygen, volume AC. Her PO2 was 7.85, PCO2 was 5.85, pH was 7.378. So as you can see, her PO2 is very low and CO2 was normal, which indicates, if I'm not mistaken, respiratory failure type 2. Yeah. And her white cell count and CRP was elevated, which indicates, and there were sputum secretions which were dirty, and a sputum culture was sent to the lab, but there were no results came in yet, which might indicate respiratory infections, probably secondary to aspiration, since she was intubated and sedated. Yeah. Cardiovascular, she's on sinus rhythm. Mean natural pressure is 135. Respiratory rate was set at 6.6. Her O2 sat was 93. Blood pressure is 154/102. And he's hemodynamically stable. In terms of renal, she was on diuretics before, but she was discontinued. She was on diuretics, furosemide and mannitol, but it was discontinued because her sodium was 151. It's elevated and increasing, so we decided to stop on her diuretics. And there's no indication of acute renal injury, as the urine creatinine is normal. So in summary, it's a MW, a 54-year-old female, intubated and ventilated, day 4 ICU, following a traumatic brain injury due to a fall secondary to alcohol. CT scan shows fractures and multiple contusions in the brain. She's currently hemodynamically stable. However, she is neurologically, she suffers neurological deficit. There's no other issues with her, and our plan for her is to do to assess her neurological function every morning and monitor her vitals. That's all.